Guidelines of preparing patients for cardiac catheterization procedures. The topic 1. Which group of patients require cardiac catheterization? Patients will need to be prepared before surgery whether they have heart wall disease or leak, atrial septal leak, abdominal aortic aneurysm, or there is a lump in the heart. Patients will have chest pain and have been diagnosed by a doctor as having ischemic heart disease. Patients with heart failure. Patients with a positive cardiac function test. The second topic, steps for receiving cardiac catheterization services. The patient will submit an appointment card at the Patient Admission Center in box number 8 at the appointment time and be admitted as an inpatient in the medical ward. The third topic, how to prepare yourself before receiving the cardiac catheterization procedure. This involves drawing blood and giving fluids intravenously, shaving the hair in the groin or wrist. The guidelines for conduct. No food or drink before the procedure for at least 6 hours. Remove jewelry, underwear, dentures, and clean your fingernails and toenails. How to taking medicine before the procedure. You cannot take the warfarin and metformin, and you can take the medicine for congenital disease and antiplatelet drugs, for example, aspirin and clopidogrel. Just like this, the patient will be ready to require a cardiac catheterization procedure. The fourth topic, day of cardiac catheterization procedure. The heart center nurses transport patients from the intensive care unit to the cardiac catheterization room. Evaluate the condition of the first admitted patient. Move the patient into the cardiac catheterization room. Equip it with equipment to monitor ECG and vital signs. Tie the ends of the hands and feet to prevent the patient from falling out of bed. Clean the needle replacement location, which could be the glowing area on both sides or the right arm area, depend on the doctor's consideration. Lay out the sterling cloth and inject anesthetic at the needle insertion site. Insert the needle at the needle insertion site, which is in the groin or right arm. A catheter is then inserted into the artery where a dye is injected and a detailed X-ray is taken of the coronary arteries, which can reveal where and how severe the stenosis is. If coronary artery stenosis is found, the doctor will consider whether to perform coronary angioplasty, which using a balloon along with stent placement. And if the coronary artery is more than 75% stenotic, the doctor may consider coronary angioplasty. The doctor will insert a coiled catheter into the narrow blood vessel. The coil expands and places on the artery wall. The balloon is then deflated and removed from the blood vessel. The stent is then left in place to explain to the coronary artery further. Then an anticoagulant is injected through the artery and monitor blood clotting values during coronary angioplasty to prevent blood clots during the procedure. The fifth topic, post-procedure care. Only patients will require cardiac catheterization. The procedure for removing the catheter tubes involves the patient lying down and stretching straight. Blood is drawn for the catheter guide tube for assays for blood clots. Locate the pulse rate to stop bleeding at the pulse position for about 10 to 15 minutes. Then remove the catheter guide tube, and if there are any abnormal symptoms while removing the catheter, you must inform the nurse immediately. After remove the catheter, lying down with your legs straight for 4 hours. Then remove the patient to the proposed cast intensive care unit. If there are no abnormal symptoms such as nausea or vomiting, you can start eating soft foods by feeding them to relatives. Eat while lying down and be careful of choking. Post-procedure care only patients who also have coronary artery enlargement symptoms. Behavior while holding the catheter in the groin or right arm where the procedure is being performed. The patient lies down with legs raised for 4 hours, and after 4 hours, the blood coagulation value is checked. If it is less than 115 seconds, the doctor will consider removing the catheter. If you have any abnormal symptoms, you must inform the nurse immediately. And if there are no abnormal symptoms such as nausea and vomiting, you can start eating soft food by having your relatives feed it. And eat while lying down. Be careful of choking. The sixth topic: possible complication. Myocardial ischemia, allergic to opaque substance, arrhythmia, damaged blood vessel in the arm or legs, bleeding at the needle insertion site, blood clots in the brain. The seventh topic: frequently asked questions.
Can I eat after the procedure?
After the heart examination procedure, if there is no nausea or vomiting, you can eat soft foods.
Can I stay in a special room?
Patients can stay in a special room as permitted by their doctor and can receive a special room in 14 days in advance at the patient center.